As millions of Americans turn to popular weight loss and diabetes drugs, doctors are raising a new warning about your vision. Experts say before you start a GLP-1 medication, you should get a baseline eye exam. That's after rare but serious eye complications have been reported, including sudden vision loss. The American Optometric Association, estimates around 12% of Americans, or every 1 in 8, have used GLP-1 drugs. At the same time, a major study in the Journal of the American Medical Association, patients on GLP-1 drugs had about double the risk of a rare optic nerve condition, but overall cases remain very low. The European Medicines Agency adds that regulators say the most serious eye complications, including sudden vision loss, are classified as very rare, affecting about 1 in 10,000 people. So it's time to look closer this morning with Jacquie Bowen, president of the American Optometric Association. So, Jacquie, good morning. Thanks for being with us.
Good morning, Rachel. Thank you for having me.
So tell us what we know about the link between GLP-1 drugs and eye health. Obviously, very new research at this point, but concerning to hear about.
Certainly. Well, as you mentioned, about 12% of Americans are taking or have at some point taken these medications, and we've had enough time now to realize that there are ocular complications that can arise due to that. They're certainly very good medications. We don't recommend stopping them, but a visit with your optometrist to establish baseline findings is very important.
Yeah, and are there any risk factors that would make someone more likely to develop this eye condition?
Yes, there are. And a lot of them are appearances inside the eye and based on the anatomy of an eye that you cannot examine by yourself. So a lot of things about the eye that cause problems are very secretive. You don't know about them until a doctor of optometry examines you. So our recommendation is, if you have not had an eye exam 12 months prior to starting these medications, make sure you get that done within the first month so we can establish any risk factors and monitor from that point forward.
And apart from getting that eye exam, is there anything else folks who depend on GLP-1s can do to lower their risk of developing this eye condition?
There are really not any active measures that a person can take. Every medication has risk factors, and when you're on one, it's responsible to have yourself assessed to make sure that those risks are not rearing their ugly head. So follow the directions by your prescriber and make sure that we are examining the eyes on an annual basis. And if any changes in the vision occur, such as loss of vision, dimming of colors, particularly loss in one eye.
So the loss of vision, is that going to come on first? Are there any other early warning signs that folks can catch before it gets to that point of vision loss?
Not particularly. It may be a sudden onset of loss of vision, and it may fluctuate slightly, but it typically doesn't resolve, on its own. Other things to be aware of: if a person is diabetic and taking these medications, there is a slight risk of bleeding and what we call diabetic retinopathy inside the eye. Also, patients who are at risk for wet macular degeneration, which is something most people are pretty aware of, it's a common condition, the risks are slightly increased in those patients. We don't recommend stopping the medication. It's transformative. These are great medications, but careful monitoring of the whole body, including eye health, is extremely important.
If someone is diagnosed with this eye condition, how treatable is it? What are patients' options?
It kind of depends on the patient and the situation. Some are treatable with medication. Some simply will improve by stopping a GLP-1. Some require further treatment by a specialist. It's very individual.
Yeah. And what are doctors seeing right now? Have you seen an uptick in these cases? Are more patients coming in with vision issues who are taking GLP-1s?
Certainly there's been an uptick, which is why we're sounding the alarms here. The risk of these rare conditions has doubled, basically, which is a small number still, but if it's you, it matters a lot. So it is wise to guard your health and just make sure you're checking in with your optometrist to make sure everything is looking good as you continue on the medications.
All right. Well, thank you so much. We have a few moments left. Anything else you want to tell folks who are taking GLP-1s before we go?
With GLP-1s and with any medication, there is some form of ocular risk most of the time, whether that's just dry eye disease or risk of loss of vision. All of those things can be dealt with earlier, and better outcomes can be had by paying close attention and making sure you have a relationship with your doctor of optometry. More information can be gained at aoa.org/GLP1, and that is where you'll find a link to find a doctor in your area that can help answer your specific questions.
Wonderful. Thank you so much.